to overseas conferences, I've just watched it get better and better and better. So it's evolved, it's matured, and now it has finally reached a stage where it's a great additional option for our laser eye surgery patients. The differences between SMILE and LASIK and ASLA are basically how you access the part of the cornea, which is the part that we laser, in order to reshape it to correct your vision. LASIK and ASLA require greater access areas, where SMILE requires a keyhole access area. The advantage of this is particularly in people who are more short-sighted and people who have more of a tendency towards dry, because what it essentially does is it reduces exposure, and exposure becomes important when you've got a higher prescription to be corrected or when you've got a tendency towards dry. With LASIK, which most people would know about, it requires a two-step process. There's the first laser to create a flap, and the second laser to actually reshape the eye, so hence a two-step process. With SMILE, we only need to use a single laser, which both creates the access point, and it also creates the little disc of material to be removed in order to reshape your eye and correct your vision. Typically, when patients and my patients go through this procedure, they feel very little. Again, they may feel a sensation of coolness with some of the fluids that we use, but they won't feel any pain and they won't feel anything sharp, which is what most people worry about with laser eye surgery. I think my patients are very happy there's an additional option for them. Again, particularly people who have the higher prescriptions and are more worried about their dry eye. The perfect patient for SMILE would be someone who has a greater tendency towards dry eye, and also someone who has a higher degree of short-sightedness, because what SMILE does, it reduces the exposure time, and in these people who have greater degrees of propensity towards dry or greater degrees of prescription, that's where reducing exposure time becomes important. As a result, SMILE offered an advantage in those patients in terms of accuracy. So that's why we wanted SMILE as an additional option, particularly for those patients.